Communicable diseases are diseases that are not spread through infection or through other people, but are typically caused by unhealthy behaviors. They are the leading cause of death worldwide and present a huge threat to health and development, particularly in low and middle income countries. These conditions include cancers, cardiovascular diseases, diabetes, and chronic lung illnesses. According to a World Health Organization report, non-communicable diseases, also known as NCDs, kill 41 million people each year worldwide, equivalent to 71% of all deaths globally. Each year, 15 million people die from a non-communicable disease between the ages of 30 and 69 years. Over 85% of these premature deaths occur in low and middle income countries. Many non-communicable diseases can be prevented by reducing common risk factors such as tobacco use, harmful alcohol use, physical inactivity, and eating unhealthy diets. Many other important conditions are also considered non-communicable diseases, including injuries and mental health disorders. Today on your regular Health TV talk show, The Physicians, we'll be discussing communicable diseases, key facts, and modifiable risk factors. Stay tuned. Another day with The Physicians, where your health is our business. My name is Dr. Martina Agbere, a regular anchor on this program. And with me, as usual, is my very delectable co-anchor, no other person than our very, very cerebral doctor.
I'm Dr. Memuna Yusuf Kadri. Welcome to your favorite Health TV talk show, The Physicians, where your health is our business.
Well, we'll be discussing non-communicable diseases, key facts,
that is a
and
big
modifiable risk factors.
Very important.
Non-communicable, why are we talking about non-communicable disease at this particular time? Because statistics have shown that they're actually the major killers.
They are. You know why I'm very key about this topic? Because that is my own subspecialty as a psychiatrist. And so, people don't even want to discuss when it comes to mental health, stigma, discrimination, and the stereotypes. And I tell them, look, the truth is that when it comes to infectious diseases, we are, to an extent, more aware than before, which means, you won't buy something by the roadside, you wouldn't want to wash it.
True.
Then with COVID, the hand washing thing became a global campaign.
Who even knew before now?
Do you understand?
Exactly.
But you see, these non-communicable diseases, they are the ones that kill people faster. Hypertension is there, which
Diabetes
is a silent
is
killer.
yeah.
Diabetes is there, which is also a multi-organ, disease that will just shut down, give you blindness.
Talk about obesity.
Obesity, they will amputate your hand or leg. There are so many things, of course. Mental illness is there. Then the cancers are also there. So, is this a good time to talk about it?
Yes, it is.
Always. And I think we need to talk about it.
We have a lot of inactivity going on, a lot of people that are not even exercising, not eating right.
Not eating right. Lifestyle.
Lifestyle.
Everybody, in Nigeria we say anywhere belly face. So but the truth is that some people just want to eat and just get full. Forgetting is not about the quantity, but the quality of the food. Yeah.
Okay, Dr. May, I think we have a guest that is going to handle this particular topic.
And of course, I'm very excited about, because she's a guru, a walking encyclopedia.
I always look forward to hosting her each time she's coming. So we're back after the short break. Stay tuned. Don't go away.
Every day and in every way, enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Welcome back. It's another day with The Physicians, where your health is our business. Today we're discussing non-communicable diseases, key facts, and non-modifiable risk factors. In the studio with me is our guest. She is a very familiar face on this program, The Physicians. That is because she's very cerebral and she's always up to date when she's talking. She is our very own Dr. ALERO Roberts, a consultant public health physician with the Lagos University Teaching Hospital. Dr. ALERO, you're welcome back.
Thank you very much, and thank you for always having me on.
You're welcome. Always a pleasure having you on set.
Sweet smile.
Yes. And the pink lipstick, you get what I mean?
Welcome.
We have to talk.
Well,
We'll talk about it.
Today you're taking...
I'm having my coffee.
Good, very good, very good.
Coffee.
So we're discussing non-communicable diseases, right? Key facts and modifiable risk factors. Maybe if I forgive us a general overview, when we talk about non-communicable diseases, what do we really refer to?
We refer to those diseases that are not transmitted from person to person the way malaria or cough or cold or COVID is transmitted from person to person. So these are diseases that are non-infectious. You know, and they often typically take quite a few years to manifest. So they may have been there in the background and we're not paying attention, and then suddenly they manifest with all the risk factors, with all the consequences, the clinical manifestations and the consequences. And unfortunately, despite the fact that we are in the low and middle income country, there's a growing number of people being affected by non-communicable diseases in Nigeria. So it's a very topical issue right now. And I think it's very important that we talk about it, because it's one of those conditions are conditions that can very quickly tip a family into catastrophic health expense. Wow. And in this new economic climate that we're dealing with, it's something we have to really consider, something we have to talk about. Particularly, as you said, they are modifiable risk factors, things that we can change, things that we can modify in our lifestyle that we can, do to prevent ourselves getting to that position.
So for the benefit of our audience and for everybody out there listening and watching us, it's good for us to also emphasize what are these non-communicable diseases. So if you can itemize, because they are non-communicable diseases. So let's just
So it's an umbrella term.
Yes,
You are very
exactly.
right, Dr. Mebuna. It's an umbrella term. So let's think of common things occur commonly.
Exactly.
Type 2 diabetes mellitus, hypertension, cancers of every part of the body from head to toe. All the cancers are part of it. Mental health, Dr. Memuna, does that sound familiar?
Very familiar.
Then metabolic conditions such as, I've mentioned the type 2 diabetes, genetic conditions, sickle cell disease. So it's an umbrella term for a plethora of conditions. The common thing about all these diseases is that there's no infectious agents, there's no mosquito involved,
Exactly.
there's no
medium
virus,
to transmit it.
no medium to transmit it, these things. And while we say that for some of them, they just are, for some of them, there are things that we're doing that put us at risk of these diseases. And I think that's one thing we have just come out of the pandemic, and for a lot of us, the effects of that pandemic, we're still feeling it. We're still a bit shaky on our feet concerning that. The last thing we need right now is any of these preventable, avoidable, modifiable, non-communicable diseases.
Okay.
So,
preventable and modifiable, right?
Yeah.
yes.
So it means you have control.
There's a measure of control one can have.
Control.
Oh, yes.
Unlike the infectious ones that you don't have.
You may not. Like COVID, we didn't have any control
over. So what are the key facts, the key risk factors for these non-communicable diseases?
Now, they are largely, I think the most important, at my level, community health, public health physician, they are largely, a lot of them are preventable. Okay. You can avoid getting them, a lot of them. So that if we can take that, what did we say? What did we learn in medical school? Attributable
risk factors.
You remember? If you take that segment out of the equation, then what we are left to deal with can be easily dealt with, so to speak. So where do you want to start? Head to toe or ABC?
ABC.
So let's start with the cancers. We know all the what we have been talking about on several occasions about, oh, no, sorry, I did say something. Common things occur commonly. Can I start with hypertension?
Exactly.
Okay, let me start with hypertension and high blood pressure because that, as you said earlier, is a silent killer.
Yeah.
And if we are West African,
meaning we are black, we are
from
African.
Senegal along the coast all the way to Cameroon, those that want to remove themselves should remove themselves. But those that from all the way from Senegal all the way down to Cameroon, if you are living along that belt, you are prone to hypertension.
More than
That is it. And it has nothing
Any
to do
reason?
because you're black and you're West African. Okay? Your blood pressure, we have what is known as essential hypertension. So fine. Point is, do you know? Because this is the key thing about the modifiable.
Yeah.
If you know, you know.
Yeah.
And then you know what you're going to do about it. So it's an awareness. So education and awareness. Because when you know and they say, oh, this is what you need to do, you will do it.
Yeah.
And please, it is not one of those conditions, I'm very sorry to say, there's no God forbid evil, there's no this is not my portion. It is God who has decided that it is like this. Let us do what needs to be done.
Yeah.
So then that's when we start talking about the lifestyle modifications.
Okay.
Diet, physical activity, weight management, stress management. Dr. Memuna, I've called your name there.
Like this is the second time counting.
I'm counting. Are you counting? You know, weight management, stress management, drug therapy. Now, everybody's going to say, hey, but you know what the cost of drugs is reporting? I say, yes, I know what the cost of drugs is reporting. But it is still cheaper than the consequences.
Exactly.
So that's you know,
statement, right?
yes. So when we go into the, I'm not going to sit down here and tell you how to diagnose hypertension or what drugs we are going to use to treat it. But you know, I'm always saying this thing about diet and exercise. Eat close to the ground. Now is not the time to be looking for imported food to be buying.
Where's the money?
Well, there you are. But you know me, even before the dollar was slapping us left and right, I have always said eat what we call locally available food. The day I told somebody that agoin beans and akara, no, agoin beans and agege bread is the same as baked beans on toast.
And that's it. It's the name you give it.
It's the name.
It's the name you give it. Yes.
Ogi and akara. It's the same thing as cornflakes and baked beans.
It's the name you give it.
It's the name you give it. So why not let us eat local? And I think people forget that there's so much protein in our natural food when we are talking about things that we can eat, and we can maintain our health eating lots of fruits. We have so many good, and our fruits are very well colored. You know,
exactly.
They say eat a lot of colors. Is it not mango? Is it not pawpaw? Is it not watermelon?
And fruit in season.
And yes, whatever agbalumo. You remember that udara? You know, eat a lot of the colored fruits and vegetables. Then exercise, and you know, this is not the time to take out an expensive gym membership. Please let all the gym owners allow me breathe.
No, but apart from being a black and being a West African, what other factors should people look out for when it comes to non-communicable diseases?
Then you want to look, because in that hypertension, I've actually started moving into the type 2 diabetes.
Exactly.
So now the type 2 diabetes, what we are finding is that it's, I mean, I'm not an expert in endocrine. I'm not an endocrinologist by me. So I'm just talking at the level of the primary care sector. So what we are finding is that it's a metabolic thing. And a lot of it is due to the, it's again diet related. In the sense that a lot of us are eating highly processed packaged foods. Which we didn't used to have. Which we did not used to do before.
I think it's just because people are beginning to, a lot of things happening because people are beginning to want to inculcate
certain habits that they think.
We copy and paste without editing.
Without editing. I like that one. Can I copy it?
Yes, please.
We copy and paste without editing. You know, you want to show that you have arrived. You know, so you go shopping.
But forgetting that even when you copy and paste without editing, those that you are copying from know how to edit.
Yes.
It's their culture.
Yeah.
And they're able to do with it.
And they're also suffering
because they have the facilities, they will manage it.
Yes, this weight management, obesity thing, when I was reading what is happening in the US, in the UK, in Canada, where they said that you know, people go into the supermarket and only pick things from the middle aisles.
Exactly.
It's processed, it's packaged, there are additives, all kinds of things inside it.
Maybe cheaper, but
because
on
it's
the long
cheaper,
run,
but in the long run, it is more expensive.
Expensive.
Whereas, you know, those who know
Nowhere to go.
know where to go to, and they're going to farmers markets, and they're going to pick things that are fresh, and they're growing in their yard, you know, and they're eating from there. And this is a lifestyle we have always had. Every one of us can acknowledge that when we go to grandma's house in the village, the food is sweeter.
Exactly.
We must have a high sense of self-awareness.
Very important.
It is so important to just do a mental maintenance. You do it for your car.
Know
you
thyself.
do it for know thyself.
Yeah.
You know, and if things are not feeling right, you keep checking. You keep looking at yourself. You know, especially when it comes to diet, when it comes to exercise, physical activity. And when I say don't take an expensive gym membership, I mean it. Sometimes all you need to do is that instead of calling your child to come from upstairs to come and pass you the remote, get up, go to the television, use the buttons on the side, change the channel yourself. Just try and incorporate more steps into your daily lifestyle. Go up the stairs, you know, walk a bit more.
Just move.
Just move.
You are not a tree.
Yes.
I would say those are even public transport. Stop at the nearest bus stop.
Yes. You know, it's so important that we pay attention. But I think that sense of awareness. And then there's another thing that we are not paying attention to. I know that Dr. Memuna is here and she can give us the whole lowdown. But a lot of us take this issue of stress management very with a great deal of levity.
And nonchalantly.
We're very nonchalantly. And we must not. The situation is enough to stress any one of us. So we need to inculcate that mindfulness, that sense of what can I control, what can I not control. Now I can have my cup of coffee or something that calms me down. Funnily enough, it does actually calm me down. Isn't that something?
Yeah.
You know, but I cannot go and drink that expensive designer coffee that they sell for almost 50,000 naira. No, it's okay. If my level is at the one that they sell in the sachet, you know, fine. What I'm in control of, I'm in control of. What I'm not in control of, I leave it. I turn my back and get back to facing that which I'm in control of. Many people keep worrying about what cannot change. And while they're worrying about what cannot change, they've left that which they can change ignored. And you know, they forget that if you can achieve one thing in a day, I went out, I came back, and I have this little cup of gari, and I saw groundnut and I bought. That sense of achievement is worth more to your mental health. And you know, people forget that this stress thing, what does it do to the body, Dr. Memuna? And those free radicals are racing around cancer.
Exactly.
Cancer.
And cancer, and the bad thing about cancer is the fact that the moment you are told you have cancer, even if you are a godly person, a very spiritual person, a lot of times it just flashes through your mind that that means I want to die.
That is it.
You know, and then people even die before their own time just because of the fear of.
If they know, that awareness, that knowledge, that gives you that sense of power and control. And I think that is something that I really want to keep emphasizing, particularly where these. The other thing I'm going to say is that do your birthday checkup. Please, once a year, give yourself birthday presents.
Great.
Go and do head to toe. For your age, go to a doctor, because they won't just do head to toe to collect your money. We don't do that. They will do what is, you know, it's like your car. At 10,000 miles, you do this. If they say 25,000 miles, you add this. That's the same thing with your body. Absolutely. If you are under 40, they know what they will do. 40 to 45, they know what they will do.
For instance, a man who is less than 40, first thing you don't have to do.
No, you don't have to worry about that.
Exactly. Anyone who is 40 and above,
well, we need to be checking. We need to be checking.
And I think, Dr. ALERO, we also need to emphasize to people that when you do your checks, please, when the result comes out, go to the physician to report.
That's why I said
people just do it and they don't bother to check.
No, but that's the problem.
Some people actually do it. Instead of going back to the physician,
they
just put the phone and call you. Hey, doctor, when I've gone to do this test, this is what is the report.
Somebody did that to me and I said, I didn't send you.
Go back to the doctor.
Because for your age, what I wanted, you did not
do it.
What you did is unnecessary.
You see?
Go straight to your physician and say, I've come for my birthday annual.
Yeah.
They are the ones who know you, know your age, know your history, know everything, and do what is necessary. I just did that.
There's nothing as good as having a basic.
That is it.
Yes.
It's not
Like
like
can then build on.
Like I'm doing
Yes.
if you do it at this particular time, next time you do it, they will come. There's
yes,
for comparison.
which is exactly what my doctor
But if you're
told
not-
me.
if you're
I
not-
said,
you wouldn't want
aren't
the
we
factor
going to
like
do this, that,
rising.
and the other? I said, no, but you did it last year. You're in the clear. You're good for 3 years.
Exactly.
So he's already booked
Saves
that
you
you are going
money.
to do this test in 2027. Can you imagine? So that one is off my, but this one, when last did you do it? Oh, okay, we are due for this one this year. That is what you do when you go for your birthday annual.
I'm just thinking out loud, I'm looking forward to when we have a time, a period where doctors, or not even doctors, where the hospitals will be able to call the patients and say, your annual is coming up on this time, or this is...
No, it's already been done. No, it's already
It's
been
already
done.
been done.
It's
That's
already
what they
done,
called
yeah.
me.
No,
They
it's
said,
already
"Ma,
been
we
done."
didn't see you.
Yeah.
Oh, yes, ma'am.
Yeah, it's
Oh,
already
yes,
been
ma'am.
done.
They called me
It's
and said,
programmed
ma,
in.
we did not see you on
Yeah.
your birthday. Make sure before the month ends, we see you. That's what, and I thought, it's true.
It's
Did they
true.
do that because they know
Yes,
For the
no,
woman-
they've
for
gone
the-
through
for
the
the mar- for the
records.
market woman?
No, they've gone through the record. That is why I said go to your doctor.
Doctor, yeah.
If you are allowed, you know, I'm always saying this thing. Where is your nearest primary health care?
Yeah.
Because they have your records. They have your records. And every day, the health educator, the health promoter is always looking at, okay, because they're checking everything from the babies too.
I
Who is due for
love what you
immunization?
just said, the primary health care. So let us encourage people.
Yes.
To go to their primary, the
And
primary
the
health
primary
care
health care
nearest to
to
them.
them.
Yes.
They don't
That's
have to go
it.
to
You
the
don't have to
bill.
go
No.
to
Yeah, Dr.
wherever.
Lero, I want us to emphasize on this particular part. Apart from the eating right and exercise, what is the role of sleep when it comes to non-communicable diseases?
You're asking somebody like me that can sleep for gold medal. Hey, most important, because sleep is the one time that the body can now rest and restore.
Exactly.
And that's where we get that R and R, rest and restore. So the longer you spend asleep at night, the more restoration your body undergoes. And then I must say this again, the number of hours you spend sleeping before midnight is so important. So please try and get to bed before 9, even if you don't sleep.
No, there's people that have exited that WhatsApp group, Lagosians.
I'm telling you. It's
Before night,
terrible.
they will tell you they will not, they're
won't go home.
still commuting.
I was
They're
so
not
angry.
getting
I was
home.
so angry that that last final match was now slated for 9
9
Yeah, I
p.m.
put off the television and slept. So I said, I'm not going to join the cohort of those who slumped and
And died.
And died
No,
because
the
they were
semi-finals,
watching-
about 6 Nigerians died.
I'm telling you.
Yeah.
For what is
Alright.
that?
Stress
And
management.
it's stress
Yeah.
management.
Know thyself.
Yes.
You have to know
Yes.
yourself.
And they're mainly non-communicable diseases.
And I'm sure they were,
Yeah.
they had
Hypertension and-
non-communicable
yeah.
diseases that
Yeah.
they had not been
They're
aware of or were not taken care of.
Yes. Yeah. Wow. I think we need a part 2 of this non-communicable.
Definitely, we do need a part
Yeah.
2 of this because there are some areas we haven't gone into. I know families of people suffering from sickle cell disease are saying
Exactly.
we have not talked
About
malaria.
our own, yeah.
So we have to take a special segment
Please.
on that with the.
Dr. Martina, we are good to go for the part 2.
Of course, part
Okay.
two. Well, she always
All
come
right.
with part two.
Exactly.
Final words for our audience. Final words.
Know thyself. Be aware. If you know,
You know.
please. Non-communicable diseases are the fastest way to catapult yourself and your entire family into catastrophic poverty. The best thing you can do is to prevent it. Eat right, move a lot, sleep well. Whatever is troubling you, divide it into what you can control. That which you cannot control, turn your back, go back to bed.
Wow.
Thank you very much, Dr. Lero Roberts.
Thank you
for the
so
very,
much.
very, very encouraging words you have just told our viewers and of course, our audience. But we've always told them that health is our business. And truly is our business.
Absolutely.
And we look forward to seeing you again to continue probably part 2 of this episode and some other new topics that we'll be inviting you for. And to our viewers out there, you've heard all that Dr. Lero Roberts talked about, modifiable risk factors. It's very, very imperative at this time that you must take control of what you can actually, you're in control of. Do you know your primary health care? Do you know the one that is beside you, nearest to you? If you have never been there, please try and go there. That will just be a lifesaver for you one of these days. And I will always say it, and I will continue to say it on our program. The benefits of exercising, I have said, if we put the benefits of exercising as a pill, it will be the best soul pill in the world. My final words for you. My name remains Dr. Martina Agberian.
Stay blessed. Thank you very much, Dr. ALERO. But of course, it's always a pleasure when you are on set, and I love your parting words. And so, to all our viewers, you've all heard it, is the easiest way to catapult yourself to catastrophic poverty and debt. And of course, we know the issue when it comes to a burden of care, and of course, quality of life as a caregiver. Non-communicable diseases, as you've all heard, they are not infectious diseases. Hypertension, diabetes, mental illnesses, sickle cell, and of course, the cancers, this is where they are. So please know your numbers, do your annual checks. If you feel something, there is something. And visit your primary healthcare physician today. Please do well to follow us on all our various social media platforms, X Space, LinkedIn, Facebook, Instagram. And if you would like to be a part of this program, we've got a new studio. So please go to our website, click in, and you'll be right here with us. Till next time, remain blessed. My name remains Dr.
And in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Daravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Daravite from LB Pharma. Daravite, love yourself.